guys, welcome back to my channel. Sorry it's been such a long time since I've made a video. I'm alive. I haven't died. I have thought about it. Sorry, you can hear my dog like clomping through here right now. I'm in my living room right now because my bedroom the lighting wasn't great in there. Hi Tsunami. Hi. So I came in the living room so you can see my kids' toys and various things, but it was just better lighting in here today. I'm actually on my way out the door to go do my clinical prep today. So I thought I had like 20 minutes where I could sit, and I was actually like wearing clothes that were semi-nice and had makeup on. I could sit and make a video really quick, just doing a real fast recap of the last 2-3 weeks. I'm currently in week 8 of my nursing program. If you're new to my channel, I'm in an accelerated BSN program, trying to get my bachelor's degree in nursing so I can become an RN. That's why I'm in my first semester. Like I said, we're just starting week 8 this week. So a few things have happened since my last video. I'm gonna kind of go in order of classes just so it makes sense. I kind of made a list so I could keep up with myself, because I'm like, I don't even know what we did the last couple weeks. I've just been running like a crazy person is all I know. So in my med-surg class, or my nursing the adult client class, that really is my toughest class. That class is the one that has the most content, and it's also the class that my clinical is tied into, so just a lot of hours being invested into this class. Week 5, we had our first midterm, and it was my first real introduction into having like NCLEX style questions. So everybody always talks about how NCLEX, which is the test that you take at the end of your program to get your license to become an RN. Everybody always says how, my dog just keeps coming and say hi. She doesn't know what I'm doing. Everyone says how they're so hard because they're basically just, every answer seems like it could be right. Usually there's like one answer that's definitely wrong, and then the other ones could all be possible. So really it's just what is the best answer. And it's different than any tests I've taken before, you know, in anatomy and physiology or microbiology or chemistry, where it's more about you just learn the information your teacher tells you, and it's more just about regurgitating it back. Like that's how prerequisite classes were. You learn the information and you just spit it back. The answers are really straightforward. The questions are really straightforward. These questions are not like that. These questions are more application. They're more critical thinking. And it's like, okay, we've taught you all this stuff about oxygen titration. We expect you to understand which device is going to deliver which amount of oxygen, you know, percentage of fraction inspired air of oxygen. We expect you to know that. But if somebody were to come in, they're this old, they're showing these symptoms, they're, you know, how this much is, these are their vital signs, what are you going to do? What's your first step? You know, or what oxygen titration are you going to give them? Or I won't even say that. It won't tell you you're even going to give them oxygen. So you have to figure that out. Like, would I even give them oxygen? Like, it's an option, but so it's really different. And it was different for all of us who are starting the program. You know, it's different than any test we've ever taken before. I did manage to get a B, which I'm very happy about. Just because I think the highest score was like a 94, and what did I end up with? I think I had an 85. So like I said, I was happy with that. Everybody always tells you how you start school, and nursing school anyway, and you know, all of us are so used to being A students. Like, we get A's on everything. That's just what we do. You know, to get into this program, if you didn't have a 4.0, it'd be really hard, just because it's just such a competitive program to get into. And so that's what I had to do. I had to get A's all the time. And so to not get an A was a little disappointing, but at the same time, I don't know, I'm not as attached to that feeling of having to get an A as some of my other students in my cohort are. I was okay with it. They tell you to learn that B's are beautiful, and C's get degrees, they say. If I would have gotten a C, I would have probably been really disappointed, honestly. But a B, I was happy with, so I'll take it. We actually have our second midterm for that class coming up on Halloween, so there's just no breaks, guys. There's just no breaks. Since then, we have had a couple lectures. We had like we had a perioperative like self-learning module, which we had that week of our midterms. We didn't actually have a lecture on it, but we are responsible to know everything about that realm. We also had a lecture about sepsis and about strokes and cardiovascular diseases like hypertension, congestive heart failure, peripheral vascular disease, stuff like that. Those are the lectures we've had so far. That's what I'm looking forward to for my next midterm. So, yeah, I gotta start studying like now. Like I was saying, this class also is tied into my clinicals, which is where I'm on my way to right now. I'm not doing my clinical today, but I'm doing my prep. So I've actually done clinical type stuff for the last 3 weeks. This will be my 4th week doing clinical. The last time I made a video, I had just done my orientation at the hospital. So since then, I had 2 weeks of shadowing. So the 2 days that I went, I go every Wednesday. I just shadowed a nurse, which was a good experience. I got to see, we're on the Surg Floor, so it's basically a floor that has people who are about to go have surgery or just had surgery, and adults, and our floor is vascular GI centered. So if they had some kind of surgery that had to do with their cardiovascular system, or the gastrointestinal system or something like that, it's kind of a hodgepodge of people there. And I've already had some interesting experiences, to say the least. I've met some very interesting patients. But for the most part, I mean, it didn't scare me off. It didn't scare me off yet. But for the most part, everything's been good. I've been able to follow my nurses around, and they have been, so far I've had good experiences. I've been a little bit nervous. Everyone says, you might get a nurse who's mean to you, doesn't want a student there, and, being prepared for that, I'm always going in with just the notion in my mind that I'm just going to do my best. I'm going to help. If they don't want me there, if they're annoyed that I'm there, I'll just kind of step back, and I'm there to help. I'm there to be an extra pair of hands for them. I'm really not trying to be in the way. I don't try to ask a lot of questions so that I'm not like interrupting them in the middle of things, but I might ask later. I really try to make a conscious effort to think, if this was me and I was at work, I'm coming into work for 12 hours, I might not want someone tagging along with me either for a little while. It might be a little bit annoying, but at the same time, it's like they've been there. They've been in nursing school. They know what it's like. They know how terrified we are. So terrified all the time. Knowing that, like, I'd like to think that when I'm a nurse, I'll be nice to people who are coming in, and I'll use them, if I could use the extra hands, I'll use the extra hands. The hospital that I'm at right now is actually a all RN hospital. So they don't have any CNAs or LVNs. So the RNs are responsible for everything with their patients. Normally, not normally, but in some hospitals where they have other nursing personnel there, that's more like a team where you can delegate things, where the RN is ultimately responsible for the assessment of data gathered, but things like vital signs and helping the patient get to and from the restroom, and bed making and baths, that stuff can be delegated to a nursing assistant. But since this hospital only has RNs, the RNs do everything. So that's why I'm basically your CNA right now. I'm basically here, and I can help you do the things that maybe you don't want to do or you don't have time to do. I can do those things. So that's kind of how it's been. Last week was the first week I actually did my first prep, and the patient I picked, unfortunately, ended up being transferred to the ICU. So I didn't even get to see him. I went to go introduce myself the day I did my prep, and he was asleep, so I didn't bug him. And the next day, when I went to go do my actual clinical rotation, my professor let me know he got transferred to the ICU. So that was kind of unfortunate. Luckily, my professor is nice, and he didn't make me redo my whole prep. I had to just do an assessment on a different patient who was there, and then just put that in with my prep instead of what I would have done, which I would have done my assessment on my patient that I had picked out. So We'll see how that goes. I haven't gotten my prep back yet to see how my grade was. I wasn't super happy with it. To be honest, like the system at the hospital, the computer system, that's where we have to go in. So today I'm going to go into my prep. That means I'm going to go in. The charge nurse for the floor that I'm on has selected a few patients that they think would be okay for students to be around, which honestly I'm not sure how they're picking people, because the ones we had to choose from last week, some of them were on like MRSA isolation, and the one that I had was there for a long time, had a lot of stuff going on, and so it was really complicated. And so I mean, it's good to learn because they're complicated, but I ended up having to just shadow a nurse that day and follow her with her patients, and she had other patients, and I was like, these patients would have probably been a little bit better for first semester nursing students who have very little experience. Like, this is our first experience in the hospital, you know? So I'm not sure how or why they're picking the patients that they are, but we'll see how today goes. But anyway, I'll go in, I'll pick a patient, and then I have to look up basically all their information about them, when they came into the hospital, why they're there, what medications they're on. I have to look up every single medication. I have to look up mechanism of action, the dose that they're taking, what the maximum dose is, side effects for the drug. I have to look up all that information, and I have to write a pathophysiology and an etiology on their admitting diagnosis. So it's a pretty big assignment, and we have to do it every week for whatever patient we pick. So that's what I'm about to go do right now. But the system that we're looking in, you know, it's brand new to us. Be going into their computers and their software and looking up the information, and so it's been kind of difficult to find the information that I want to find. But you know, I'm working on it. Today will be my second time trying, so I'm gonna try my best to look for what I gotta find, and hopefully I'm successful. That's my med-surg class kind of wrapped up. My other big class is my assessment and skills class, and this class is kind of stressful all the time. We're at school for this class. We're not actually in the hospital. This is where we're learning basically the hands-on skills that we're applying in the clinical setting. So it is kind of weird that they aren't the same class. My clinical set up with my other class, but yeah, I don't know. But I have talked about checkoffs in the past. We had my checkoff for vital signs. So since then, I have had 3 more checkoffs. I've passed all of them with flying colors, luckily. We had my head to toe checkoff, which basically we had to perform a head to toe assessment on a mannequin. And the way checkoffs work, like I've said before, checkoffs are, it's basically like a public speaking event where you have to get up in front of your professor, just you and your professor in the room, and you have to show them, you have to basically pretend, you have to act like as if you're in the hospital and you're going through all the steps of how you walk in the door, what you do, the steps to get to that point, and what you say to the patient, how you address the patient, what you do when you get there, and then actually perform the skill you're trying to show, and then how you exit. And if you don't do certain things, there's hard pass or fail issues that go along with each assessment. And if you don't, then you fail that the first time. You get a second time to try, but your score goes from 100 points to 67 points. And if you fail the second time, then it's kind of a big deal. It's kind of an issue. Like, all right, we got to see what's going to happen. I don't know what 100% happens. I don't know if anyone in my cohort actually has failed a second time. But they want us to pass. So it's not like they're trying to trick you, but sometimes they are. The head to toe checkoff was pretty straightforward. That wasn't too bad. I had to do a catheterization and sterile technique checkoff. They were together. That one was a little bit more stressful because basically we learned Foley catheters or indwelling catheters and also intermittent catheters. So, and then of course there's, administering it to a male and administering it to a female, and there's different steps that go along with each of those. So basically there's 4 different options, and so for our checkoff, they had all 4 options, like male Foley, male intermittent, female Foley, female intermittent, and they had them on a piece of paper in a jar, and we had to dig around and then pick out what we were gonna do, like right there on the spot. So it was a little bit intimidating. And that was the first time too I had from my proctor, basically one of the professors that everyone is a little bit intimidated by. And I had him again for my second checkoff from my most recent one that I did. We had to do another one for non-parenteral medication administration, and I had him for both checkoffs. And I was just like, how did I get so lucky? Like, why is this happening to me? But honestly, he was fine. Like, I practiced, and I practiced before I went in, so it's just a matter of, I'm getting like nervous thinking about it right now. It gives me so much anxiety on those days, and it's like everyone's anxious in the classroom. Like I said, I've never thought I would find people who were as anxious as me, but people in this class are even more anxious than me, and it brings out so much anxiety in me, and I don't understand. Oh, it's just really difficult, and everyone's stressing out. Everybody else is stressed out about the same thing, and we're all in the same room together, and just a bunch of nervous energy, and it's exhausting. Like, by the time we finish our checkoff, we still have to stay and then learn a new skill after that, and I'm so tired. Like, it's physically exhausting to be that anxious for, you know, an hour or two while you're waiting for your turn to do your checkoff. So, like I said, we did the head to toe, we did catheterization, sterile technique, and we did the non-parenteral, which non-parenteral medication is basically oral medications, topical ointments, eye drops, ear drops, nasal suppository, not nasal suppositories, nasal drops or sprays, also suppositories. Anything basically that's not injected is what that counts as. So since I passed all those checkoffs, that means that when I'm in the hospital under the supervision of the RN that I'm working with, I can do those things. So I haven't had the chance to do a catheterization yet. That was just last week that I passed that skill anyway. Most of the patients on med-surg already have a catheter, but I can administer medication this week, so that's kind of exciting. That's something that, you know, being there, we don't have a whole lot that we can do yet, you know, but now we have more checkoffs that have happened. We can do more things, so that's exciting. So I'm excited to do that tomorrow, to use the Pyxis and pick out the medication and, you know, get to go and do something besides just stand around. I think that's kind of what I'm doing a lot of. It's just like in the background, like, I'm sorry, I don't want to bug you. I did take someone's vitals last week. That was exciting. I had to use their machine, and I forgot to hook up the blood pressure cuff. I like put it on the lady and then push the button, and I'm like, why is this not working? I don't understand. I'm like, oh, I gotta hook it up. Okay, sorry. But she was very nice, and you know, part of my thing, I have a lot of anxiety with clinicals too, and I don't know, I feel weird touching people, which obviously that's something I have to get over being a nurse, but I don't know, it just seems like I have, but I don't know why I'm weird about it. The patients don't care. Like, they understand that they're there and they're in the hospital. They're being touched by everyone, so they're used to it. And so I need to just remember that when I'm doing it. Like, they're used to it. They're expecting this. It's not weird for you to touch them while you're doing their vitals or while you're doing their assessment. That's not weird. And so I have to just get over that in my own mind. We also had our midterm for our assessment and skills class, and that test was a little bit more like tests I've taken in regular classes before. It was a little bit more straightforward. It wasn't as difficult. I got an A. I ended up with a 92 on that test, so I was very happy about that. And the other thing that's tied into our assessment class, I am like sitting here for so long. The other thing that's tied into our assessment test, our assessment class, is SimLab. And so SimLab is another source of anxiety for me, which is where they put us into a room with a high fidelity mannequin. The mannequin has vitals, the eyes blink, you know, and they have a person who's behind double-sided glass or two-way mirror, and they're voicing the mannequin, and so they're just acting like they're the patient. And then so it's usually two of us, like me and another person in my section in there, and then the rest of my section is sitting in another room watching us, seeing how we're handling the situation. And so it's very stressful. It's very, very stressful. Since the last time I talked about anything with you guys, I've done 3 sim labs. One was a post-mortem sim lab, so we had to go in and pretend that the patient had died and that their loved one that was sitting there, and we had to go through all the steps. And what's frustrating about SimLab is that we really don't get a whole lot of prep before we go in. Like, we hadn't learned about postmortem care. We still really haven't, to be honest. I don't know if that was our introduction and that was how we were supposed to learn. I mean, that's kind of how it seems. They kind of put you in there. You don't necessarily know what to do. You have to just work under pressure and figure out how to figure out what you're going to do. And then you come back and then you get critiqued by the professor and they tell you what you did right, what you did wrong. And so in that way you learn. But it's so stressful. It's so stressful. They give you like a minute outside of the room with the patient's chart so you can get information about them. But really it's not that very much time to look up everything on there. And I don't like it. I don't like it. We've also done one. We did another collaboration with speech language pathology students. So we did one with them where we had to do like a swallow screen with a patient. And then we also did one with some pharmacy students who came in, and we did like different ones that involved medication, reconciliation, and stuff like that. So I don't like sim labs. They're getting less stressful the more I've done them, but they're always different, and they always try to throw curveballs at you. So yeah, it's really stressful. I wish we didn't have to do them, but I understand why they're important at the same time. I wish we maybe had more time to prepare for them. I think that's not the point. So my last class is my N111 class, which is, I don't know what you call it, professional nursing, I think is what it's called. That's what the book is called. And this class is like my easy class. This class I don't even think about. We have our first midterm for this class this week in a couple days. And this class just focuses more on, I don't know. We learned about informatics the other day, and we learned about the healthcare system. We had to watch a movie, what was it called? Escape Fire, and we talked about the healthcare system and its flaws. So it's just more of a talky class. Everybody goes in there and talks about their feelings and what happened to their family and stuff like that. And it's just a little... It's a nice class. It's not too stressful. We don't have to do anything besides go to lecture. So, yeah. There's not a lot going on with that class, to be honest. Just go to our lecture every week, and then our midterm's coming up this week. So we'll see how that goes. I'm not too worried about it. I'm going to focus on the PowerPoints, and then we'll see how that goes. So, now that I've been sitting here for too long, and I should have left to go to my preps, I'm going to be late to that now. But that's okay. I hadn't done a video in a while. I needed to get it out of the way. Let me know if you have any more questions. I'm so surprised to see new subscribers all the time. I'm like, people want to see my videos. That's cool. So I really wanted to make a new video because I knew I hadn't made one in a couple weeks. So let me know in the comments if you guys have any more suggestions for videos. I have gotten a lot of requests for basically, you know, how I do this as a mom and how I, you know, a day in the life kind of a deal. So I would like to do a video like that. I'll probably do that soon. Like I said, I'm still trying to figure out how I'm doing this as a mom. It's a learn as I go process. But the biggest thing I can say is that I have support from my husband and from my family, and without that, I wouldn't be able to do this. It would be impossible. So luckily, because I have their support, I am able to spend the time at school and study. And yeah, my kids have been awesome too. They really haven't seemed like they're suffering from lack of their mom being around. You know, I'm really not around that much less, to be honest. So, but anyway, that'll be another video. So again, thank you guys for watching. Thank you for subscribing, and I'll see you guys next time. Bye.